I've had the opportunity to speak with a few students at Georgia State, and here's what they had to say.
Were you aware that Emory University Hospital held an Ebola patient in care?
Yes, I was aware.
How did you feel about that?
I felt that it was the right thing to do. I mean, we have one of the top hospitals in America, so if they have a chance to cure this patient and save his or her life, why not?
How would you feel about being so close to home, with you going to Georgia State and Georgia State being in Atlanta and Emory being so close to Atlanta?
With all the safety protocols, I feel like I had nothing to worry about. I mean, I am human. I don't want to die. I don't want to contract anything, but I feel like they have one of the best, policies and protocols and procedures with dealing with those kind of things. So I wasn't scared at all.
And what precautions have you taken to ensure that you are aware about the effects of the Ebola virus?
Well, I have actually attended one of Emory University's press conference or one of their symposiums about the disease. I have went there. I just stay current up on my facts. I Google always. I watch the news.
So, how did you feel when you heard that Emory University had Ebola patients?
Um, I guess I felt okay about it since it wasn't at Georgia State. I
Since
probably would have felt a little different if it was here.
How would you feel if it was here, though?
I probably would be a little bit more careful about where I went to the bathroom or people that I came in contact with.
What did you feel about Ebola being so close to home?
I guess I usually try to think positive about stuff like that, so I don't think it impacts me personally because I don't know anyone with it.
So, how would you feel if someone at Georgia State contracted Ebola?
Oh, I probably would be really concerned. I probably would want to know who it was and, what classes they're taking and if I interact with them or not.
I've had the opportunity to speak with Lynn Long, who is a certified nurse and also is a faculty member of the nursing school at Georgia State.
Hi there, my name is Lynn Long. I am a faculty member with Burdine F. Lewis School of Nursing, and I am also an advanced practice nurse. I teach in the graduate programs for nurse practitioners, and I also have a half-time position with the Division of Research doing occupational health. I am an advanced practice nurse. I'm board certified, and I am a generalist. I am not a specialist. So what I would like for you all to know is that I am not an infectious disease specialist in Ebola, but I am willing to answer any questions you might have, and also to remember that I am not a representative of Georgia State in terms of Ebola education for the university.
Could you tell me what exactly Georgia State is doing in regards to teaching their nursing students about the Ebola virus?
Here in the nursing department, Dr. Fisher, who is our associate dean, she directed me to develop a D2L course for our nursing students that will help them get the facts and educate them about Ebola. Examples of sites that they might visit are cdc.gov. The American Hospital Association has a website that talks about Ebola. The American Nurses Association has a website. There are just multiples of websites out there right now in the healthcare field that address Ebola.
As a licensed nurse, can you tell me any advice you have for the students of Georgia State who are fearful of catching the Ebola virus?
As a nurse, first of all, Ebola is blood and body fluids, and it is not an airborne virus that we know about. Cases of Ebola in the United States that have been contracted in the United States were contracted because those nurses were in close contact with patients who had active infectious Ebola disease. And I think what we have discovered is that their personal protective gear was not adequate to protect them in that setting. So for students at Georgia State, you know, Ebola is not infectious until you have symptoms. So symptoms of Ebola are, you know, things like headache and fever and body aches and fatigue and really late, you know, abdominal symptoms like nausea, vomiting, and late symptoms. It's called used to be called Ebola hemorrhagic fever, because the blood vessels start breaking down and you get hemorrhages into the skin that can be seen. So students at Georgia State need to remember that if they have fever, that their most primary concern at this time of year is going to be flu. But what they want to do is get their flu shot so that they're protected from flu. And if they have any exposure to known Ebola victims or patients, then if they were to develop fever, they would want to seek immediate care from a healthcare professional.
What about protecting yourself on campus?
In terms of protecting yourself on campus, good hand washing. Remember that it is blood and body fluids, so you would want to do anything that would protect you from coming into contact with any other person's blood or body fluids. So things like tattoos are going to have a new meaning. Of course, IV drug use is sharing of needles. That would not be something that you would want to have happen in any situation. And you know, just general blood and body fluid protection. When you're talking about a student just on campus, you would want to have good hand washing, make sure that you're getting your rest, which is hard for a student because students are up all night long and tired from studying. You want to be sure that if you have any symptoms of flu or colds or viral illnesses like stomach bug, that you stay away from your fellow students until you are well. And that's just generally good infectious disease practices on a college campus anyway. The other thing you can do to protect yourself is make sure your immunizations are up to date and that you've had your flu vaccine this year. So that will decrease any confusion a great deal. The other thing to remember about Ebola is that fever, if you've not been exposed to an Ebola patient, your fever can't be from Ebola. So if you are traveling outside of the country and you go to an area that's endemic with Ebola, when you come back to the country, you'll go through the usual screens at the airport.
What did you say when you heard the Emory University Hospital was taking care of an Ebola patient?
Thank goodness, because Emory University has prepared for this situation for many years. And Emory University is housed next door to the CDC. They are the most familiar with a disease process like Ebola, and they have the containment environment to actually take care of patients with infectious diseases that we are not accustomed to seeing on American soil. So I thought that this was just really a very good thing that these patients were being brought to Emory and then to Nebraska.
Is there anything else you would like to add?
When you're thinking about Ebola and Ebola at Georgia State, make sure that you get the facts and that you educate yourself, and that will go a long way towards preventing fear on the college campus about being exposed to something infectious like Ebola.